Dr. R. Deuk Majan at Deuk Spine Institute, here with one of my patients who underwent the Deuk laser disc repair, which is endoscopic annular debridement and discectomy L4-5 yesterday. And how long have you had back pain before surgery? How many years?
I've had it probably 10 years.
10 years. And it was there all the time, every day?
Well, no, not every day. It'd come and go.
And in the last few months?
The last 5 or 6 months, it's been steady.
Been steady, constant. Do you still have that pain today?
No.
It's gone?
It's gone.
Cured?
Yeah.
Yeah, it's
overnight,
cured.
it's gone.
It was, yeah, overnight. So, the Deuk laser disc repair is the only surgery in the world that cures back and neck pain and thoracic pain. He had back pain, and he had it for years. And were your legs involved? I don't think your legs were involved, right?
They were at a couple of times. Last December, a year ago, my left leg would bother me for about a week. And my right leg in the spring, just for a short period of time.
Okay.
The leg part went away.
So the leg symptoms were likely caused by inflammation within the annulus, the posterior annular tear, causing inflammation that was getting onto the nerve roots and causing leg symptoms, but yesterday you didn't have any leg symptoms, right, before surgery?
No.
So it was really back pain that we were treating, and that's gone. And you had an outpatient surgery, correct?
Yes.
You didn't stay in the hospital. We did it here at Deuk Spine Institute. Are you happy with your results?
So far, it's been great.
All right, good. Anything else you want to add?
No. Hopefully, I don't have to go through this again.
You won't, as long as you don't re-injure it. You'll be fine. All right, thank you. Thanks a lot.